Good afternoon from Tokyo. My name is Agnes Sari. I'm the deputy head of the Capacity Building Department of the Asian Development Bank Institute, ADBI, the think tank of the Asian Development Bank. Welcome to this webinar titled Gender and Care Economy, How to Empower Women how to empower women through creating new care economy sector. With demographic changes, societies continue to heavily rely on women as unpaid caregivers, but this traditional approach has not been conducive for women's empowerment, gender equality, or sustainable development for all. Women spend significantly more time on unpaid care work than men, which limits their access to education, employment, and other opportunities, compounding existing structural barriers. This unequal distribution of responsibilities remains a critical obstacle to achieving gender equality and increasing well-being for all. With proper formalization and supportive policy implementation, the care economy has the potential to generate decent jobs and contribute to inclusive economic growth. While governments play a central role in investing in and shaping care systems, public sector resources alone are not sufficient. Leveraging private sector investment and harnessing technological innovations will be essential to meet strong care needs and close care deficits. In 1 hour, this webinar, designed with the Asian Development Bank and 2X Global, is meant to explore how existing gender disparities in the care economy can be addressed through effective government policies and increased private sector investment in delivering care services and infrastructure. So let's go deeper into this topic, and to continue to set the scene, I'm very happy to welcome Tamar Borzvadze, Gender Officer at the Asian Development Bank Resident Mission in Georgia. Today, Tamar will further explain why investing in care economy is critical to empower women. Tamar, thank you for being with us today. The floor is yours.
Thank you, Agnes. Thank you so much. And good morning, good afternoon, good evening to everyone. It is a real pleasure to be part of this webinar with my fellow panelists and all the attendees who are joining us today to talk about a very important, a fundamental, yet often overlooked pillars of economy, our economy, which is a care work. And thank you very much for a nice segue, Agnes. And thank you for ADBI for this opportunity. As you just mentioned, yes, we all know that every society, every economy rests on the shoulders of those who care, the people who raise children, look after the sick, support persons with disabilities, and accommodate the elderly. And yet, this essential work is too often invisible, unpaid, or poorly paid. And what is very important, what you've just also mentioned, Agnes, it's a burden overwhelmingly carried by women all around the world. Could you please move this slide? I just want to start by emphasizing that care is not just a social necessity, it is a powerful economic engine. And economists often refer to care work as a hidden infrastructure, the system that quietly keeps everything else running. And yet it's quite simple. Without care, we would not have a functional economy. There is no healthy workforce, no productive worker, no one else available to participate in education, deliver healthcare, or show up for any other job. But despite this, care work, especially unpaid care, is rarely accounted for in GDP, gross domestic product. The International Labour Organization estimates that if we did count this unpaid work, it would represent up to 9% of global GDP. In many countries, this is larger than entire manufacturing sector. So the truth is that investing in care simply makes smart economic sense. First, it is a job creator. Care generates more jobs per dollar than sectors like, for instance, construction or energy, and those jobs are local, green, and resilient to automatization. Second, it boosts the entire economy. For instance, McKinsey Global Institute estimates that closing the gender gap in care and labor could increase global GDP as much as 13 trillion USD dollars by 2030. This is not just about abstract numbers, it is about reshaping social contracts and women's labor and potential. Next, please. Investing in care delivers what we call a triple dividend, three layers of simultaneous returns. First of all, it provides women with access to decent work, what you've also mentioned, and frees them from disproportionate burden of unpaid care, increasing female labor force participation. Second, which is also very important, it ensures that families, children, the elderly, and the person with disabilities receive high quality care and professional support. And the third one, increasing female labor participation, expands the productive base, leading to a stronger, more resilient economies overall. So every dollar invested brings these multiple returns. When care work is properly recognized, fairly distributed, and adequately rewarded, it allows women to participate fully in economy and political life. It changes all stereotypes and invites men as well, employers and governments to share the responsibility for care. At ADB, we've seen this directly. Our joint work with ILO, UNDP, and other international partners on childcare in 48 economies across Asia and Pacific confirmed a clear linkage that greater public investment in childcare really strengthens gender equality, increases women's workforce participation, and supports sustainable development. The evidence is pretty solid. Next, please. So let me tell you how ADB puts this evidence into practice and in action. While our portfolio historically focused on long-term care, we've done projects, we developed projects in PRC, Vietnam, Indonesia, we're now diversifying our approaches to cover the full spectrum of care services from early childhood care to elderly support and assistance to persons with disabilities. So we invest in three main areas. First of all, it's sovereign operations, the government lending. We finance the hard infrastructure, national care frameworks, and service delivery systems needed to expand access to services, care services. Through private sector operations, we use public-private partnerships, PPPs, and blended finance to work with partners to expand quality and reach to care services. And through our technical assistance programs, crucially, we support policy reforms, strengthen institutional capacities, and pilot innovative care models, like our ongoing regional TA on promoting sustainable quality and affordable childcare in Asia and Pacific, which is mentioned here on this slide. And to emphasize also is what is important is that our strategy is quite broad. We engage both upstream work, which means shaping policies and systems, and we work on this level, and the downstream work, supporting actual service delivery, so that care systems are not just expanded, but also are sustainable and inclusive. In short, we aim to create care services that are accessible, high quality, and equitable, benefiting communities across the world and most importantly to women. So let me share a few examples of ADB, how we finance care infrastructure and care systems and services. I will start from Georgia example because I'm based in Georgia. I come from Georgia. So currently, ADB is supporting the government of Georgia in formalizing and standardizing home care services for elderly. So in the country, many families struggle to access these services because the coverage is uneven in the country and they lack quality standards. To address this, we're working with the government of Georgia to refine these quality standards, train care providers, and also creating opportunities for private sectors to step in this realm. For children and persons with disabilities, we're also supporting the government of Georgia in developing quality personal assistance package. This ensures that beneficiaries get the support they need, while carers, who are mainly women, can pursue work, education, and any other opportunities. In short, we're helping formalizing caregiving and integrating it into a broader social protection systems, making care recognized, valued, and more sustainable. To move to Kyrgyzstan, where the early childhood care and education system is at a turning point, the government committed that by 2030, they want to achieve 80% of coverage of preschool children accessing affordable and quality childcare services. And through our technical assistance, what I mentioned earlier on, we're supporting the government in economic and financial modeling, strategic financing, teachers' capacity building, and quality assurance improvement. So all these efforts would enable quality and inclusive care for children, and at the same time, it would create opportunities for women to join the workforce and participate more fully in economic life in the country. To move to the next slide, I can give you another example how we're supporting Uzbekistan and Philippines as well. We're driving innovation through the private sector operation in Uzbekistan, where we're advancing our public-private partnership by creating 500 new preschools that will eventually benefit around 75,000 children in the country. Our support really spans with the full project cycle, from project preparation and structuring to the procurement of qualified private providers and partners. So this builds on ADB's broader experience with PPPs across different sectors, including education and health, helping ensure that the project not only increases access to preschool education, but also strengthens institutional capacities and long-term sustainability of childcare in the country. In Philippines, on the other hand, we are focused on developing and promoting employer-based childcare options, helping the private sector, generally the private sector, defining what quality, affordability, and accessibility looks like in practice in terms of childcare. To wrap up, when we talk about the return on investments in care, we're not just talking about the bump in the gross domestic products, GDP, we're talking about something much bigger, how we support gender equality, inclusion, and human development. Because investments in care economy boosts productivity, promotes gender equality, and fosters stronger and more inclusive economies. But recognition alone of the unpaid care is not enough. There is still a lot to do to turn our commitments into real, more tangible results through budget, policies, and programs that truly treats care as an essential work, because at the heart of the care work are women. And when we invest in care, this means that we're invest in women, and that when we invest in women, we invest in the future of our families, our communities, and our countries. And we're committed to further support these efforts at ADB. Thank you very much.
Thank you very much, Tamara. Indeed, these examples are very clear, and this is also clear that there is a big return on investment for society and economies when care, or the hidden infrastructure, as you said, is invested and supported. And it is interesting also to see how public-private partnerships have been key to develop childcare in your examples. So now let me introduce our second panelist to continue the discussion. I'm delighted to welcome Tatiana Gerling, who is a sustainable investment practitioner with FMO, the Dutch Development Bank, and she's also ambassador to Japan for 2X Global. 2X Global is an organization for investors, and it developed a standard to promote gender lens investing. Today, Tatiana will explain to us how gender lens investing can be critical in building the care economy. Tatiana will also further present the business case for private-led care economy initiatives. Tatiana, thank you for being there with us. The floor is yours.
Many thanks, Agnes, for this very warm welcome. And many thanks to Tamara for laying out what the care economy is and why is it relevant for gender questions, gender topics. I represent 2X Global. That is the platform, if we can go to the next slide, that was called into life by the governments of G7, and later on involved many more countries, policymakers, and investors, because of the same question that all of us are facing: how to sustain and further develop our economies, and keeping in mind that, as Tamar said, after each paid worker, there is somebody who is doing unpaid care work. And before I dig in how it materializes in the countries of our influence, I would like also to introduce the definition of what is gender lens investing and why we are talking about gender lens investing in the context of care economy. First of all, gender lens investing is making a financial decision, just adding additional lens, how this money, this investment either brings benefits, financial benefits, opportunities, access to capital, access to job, opportunities to earn money to women, or let's say if those criteria are not considered, how it disadvantages them. And if we go to the next slides, I will give you the answer why it's relevant. As Tamar already mentioned, most of unpaid domestic and care work traditionally in our societies is done by women who traditionally for centuries would be taking care of the families, of the domestic work, while men are earning the financial income for the family. Thanks to very serious advancement in access of women to education, we saw that many women receive education, and it cost governments and families and private households considerable amount of investment to educate women. And we see in many countries, most of the women are receiving good education. Particularly it applies to Asia, where that's the remit for the Asia Development Bank, the area. And we see that often up to 50% of the graduates, which reflects the gender the balance in our societies, graduate from the universities, they have advanced degrees. However, what we see, and if we go to the next slide, we see the situation that as soon as the women are out of their educational institutions and they start working, and the decision is made to have a child in the family, then women face a dilemma. They either have to drop out of the working sector, or they continue working, but they cannot afford having children because very often care facilities are missing. And that one, not the only, but one of the drivers why we see fertility rate is going down in many of our countries. And if I look at the fertility rates, that's one of the graphs that shows that across the world, the fertility rates are going down. However, we need the next generation, keep creating economic advancement for our societies, because our societies are based now on the model where the new generation, which usually used to be more numerous than the previous one, is paying social costs in the societies. However, that's not any longer possible if we don't have enough children. And that's where the gender lens investing connects to a care economy, where we find solutions to take care of the children, to take care of the elderly parts of our population, and free up qualified female resources to contribute to the economy. If we go to the next slide, I will very quickly outline how a resolution of macroeconomic issues related to lack of workers in our economy actually can be unfolded into providing microeconomic solutions, investments in the companies like the ones that Tamar listed, but also the ones, exciting examples that Chunmei Huan is going to present after me. First of all, it's crucial, and it should start with the governmental initiatives, ideally, as Tamar also showed in her examples, recognize that this is the issues, try to reduce the burden of unpaid work, and redistribute those duties to other sectors, create new sectors. However, it's not enough. The continuous monitoring and continuous promotion of equal parent and care leave for men and women plays also a crucial role to take the pressure only from women on taking sick leave, let's say if the child is ill or the elderly person in the family. Collection of use of gender disaggregated data is extremely important to analyze whether the measures that are implemented, investments are made, actually bring the positive outcomes you would like to have. And last but not least, I would like to say that changing gender roles, that's what we're talking here about, changing gender roles from traditional ones where only women are caregivers and men are earning money, but making them at least more equal, requires change management in the mindsets. And from my perspective, that's the most important area. Only then the advancement can be made, the changes can happen in everyday's decision. And that's what I call social and economic dialogue of all parts of the population, men and women alike, decision makers, and overall population. If we go to the next slide, then I would like to say that's exactly what 2X Global is created to do, to start the dialogue, to facilitate transformation of the societies through redirection of the capital. 2X Global that I represent is the group of banks. Currently, it's over 200 institutional participants who look at how they make their decisions within the organization, the investment decisions, incorporating the gender lens angle. We have governments, we have companies who take up the 2X challenge and that commit certain amount of money to invest into gender lens, with a gender lens. And we also have initiatives such as 2X Ignite to educate fund managers, to educate decision makers who manage funds on making the right decisions. If we go to the next slide, we will see that that group was constantly growing since 2X Challenge was introduced in 2018. Asia Development Bank is, by the way, one of the key members of the 2X community, and it made the journey from approximately 3 billion committed by all the members in 2018, all the way to, we're speaking about globally, $20 billion US dollars committed currently. It means demand is there, business case is there, and 2X is facilitating exchange on how these investments can be done. If we go to the next slide, I would like to share with you the heart. whenever you make a decision, it should be a well-informed decision. You should know what to track and what to measure. And 2X criteria are seen as a global standard for gender finance, similar as 1 ton of greenhouse gas or CO2 emissions is considered to be a global standard for climate investing. And that's, I would say, pretty simple metrics that can be applied for any institution, any business, any decision making. First, you have to take care of the risk. You should avoid gender-based violence risks, which is a part of standard ESG risk metrics. You should ensure that there is policy within the company, within, let's say, if you're taking care of the governmental decision, that the advancement within the country, gender strategic actions, such as we reward individuals, regardless whether men or women, based on their professional qualities, and advancement based on their professional qualities. And then the companies, investors in their decision making, as well as companies that are looking for investors, can prioritize one of the key topics for gender equality they may select. Is either entrepreneurship and ownership, founder of the company. It could be leadership, number of women in senior management, in employment. And that's 2 other criteria very exciting because they were added last year. And that's where many financial institutions recognized that you cannot just look at your immediate investee. It won't change the system. You will be still finding it difficult to have a buy-in of all other partners and parts of the society. You have to look in your supply chain. For example, we're in Japan right now. And if the supplier of, let's say, one of the biggest companies, Toyota, will be ask the same questions as the employees, as the leaders within the Toyota company, the change will happen very quickly and much quicker, because we're speaking here not about only Japan-based companies, we're speaking about overall Asia-based companies, and that's how the whole system starts working. The same applies to products and services. Whenever you make an investment, ask additional question. How will this product benefit women, support them in their professional capacities? Care sector is currently growing. Investing in the care sector makes sense, and asking the question whether that solution will support creating care solutions also would be fundamental. If we go to the next slide, I would like to give you a couple of examples that from our 2X perspective really meet gender lens investment purposes in the context of care economy. Japan started strongly in 2018 as the G7 was one of the first countries who committed funding to specifically gender lens investment. And what I show here is actually how it started. First, the money was committed by the government together with the private sector. It went to the bigger Japan ASEAN Women Empowerment Fund, to the manager of the fund who was already adopting 2X criteria for its own management. And it was further trickled down to microfinance institutions in Asia, SMEs, business groups, all of them to invest with the gender lens, which also includes the care economy products. That was a strong push, and currently the fund is well managed. It generates returns. It means there was a business case in it. If we go to the next slide, I would like to give you another example. We live in the global world, and that's where the certain caregiving services and platforms provided in another country resonate and spread and being adopted by other countries with the same challenges. We know that in Asia, the birth rates, as I showed also before, have been, I would say, not growing to say the least, but rather falling in many countries, and in particular in Singapore. That's where one of the startups introduced healthcare provider solutions, where they were matching families with qualified professionals, reducing time spent on childcare. And that's helping to replace unpaid work by women done traditionally with access to the care economy solutions. Another example, if we go to the next slide, is in Bangladesh, and that's where health and access to proper health solutions as a part of the care is important, and that's where innovative entrepreneurs were providing access to digital pharmacy platforms where you can quicker get access to the health issues targeted either the women health or again health of the families. So these are a couple of examples that keep improving accessibility of the healthcare sector, of the care sector, thus decreasing pressure on women and creating jobs and incomes for entrepreneurs. I think this is my last slide. If we go to the I think I'll skip it because I would like to give more time to Chunmei Huan to present. She has an amazing case to present. Thanks a lot for your attention, and that's it from my side.
Thank you very much, Tatiana. Indeed, shifting the unpaid care work done by women into paid services through gender lens investing and through 2X criteria is clearly a game changer. This is a strong macroeconomic policy, I would say, and policymakers as well as gender lens investing can powerfully support this trend. Now the business case for investing in care economy is clear as it generates financial, economic, and social returns. Let's dig into some more concrete examples. And for that, I'm delighted to welcome Shunmei Huang, general partner of 2 impact funds in Japan. And she's also a board member of the Global Steering Group for Impact Investment Japan. So today, Shunmei will share with us some case studies from Japan experience in investing in the care economy. Shunmei, thank you for being with us, and the floor is yours.
Thank you so much. My name is Chunmei Huang, founder and general partner of 2 impact investment funds, Hatak Fund and Impact Capital Fund. It's my great pleasure to share our story with all of you today. I think Tama talked about public investment, and Tatiana talked about gender lens investing and the 2X global initiatives. I think I will focus more on private investment side. Next slide, please. In my presentation, firstly, I'd like to share our journey of investing in Japan's care economy through impact investing, and then the case studies of our portfolio companies in the care economy. Regarding my career, I was with Shinsei Bank, one of Japan's main banks, for 19 years until last January. I was continuously responsible for private equity investments, starting from buyout, followed by strategic investment, fund investment, and venture investment. Next slide, please. In year 2017, I built the impact investment team and launched our first impact investment fund, so-called Child Care Support Fund, which was also the first impact investment fund for Japanese banking group. The impact investment program actually was not a request by the bank. It was an initiative by myself and 2 other female bank employees based on our own child care experience. I was born in China and came to Japan many years ago to pursue my master's degree. Actually, staying in Japan was not part of my original life plan, but life here turned out to be very wonderful. Great food, kind people, and a safe, clean environment and beautiful nature. However, when I gave birth to my boy in 2010, I realized how difficult it was to achieve work-life harmony in Japan. After COVID-19, working from home became an option in Japan also, but back then it wasn't available. If your kids got a fever, you will get a call from the care center asking to pick up your boy immediately. It was also difficult to even secure a seat in public child care facility at the time. Meanwhile, in Japan, unlike the generation of my parents' age, many women today continue their careers after marriage or childbirth. We saw a significant growing demand for child care service, and people are willing to pay for them. At the same time, digital transformation in Japan accelerated the implementation of new solutions in society. And we also saw male young entrepreneurs in Japan tackling these social challenges with great passion and capability, making this field very attractive also from investment point of view. However, in year 2016, there was few successful cases of investing in child care economy. So it was not easy to pursue my senior management to make this investment. Fortunately, we came across the advanced impact investing framework in the UK, which considered not only risk return, but also impact as a third dimension. The approach of impact measurement and management, this is we call it IMM, can become a core and efficient part of company's management process, enabling business to achieve sustainable growth alongside the impact creation. And after a 9 months feasibility study, we finally persuaded the bank's management team and launched our first fund using bank's principal capital and invested in 6 companies. Next slide, please. Thank you. In year 2019, 2 years later, we launched our second impact investment fund, co-managed with Social Innovation Investment Foundation, and also with participation from 11 external institutional investors. We also expanded our investment scope from childcare to include healthcare, elder care, and also new work style related business. We have successfully invested in 11 startups. Next step, please. And last year, after leaving Shinsei, I partnered with my Shinsei colleague, Sayaka Takatsuka, to launch our third impact investment fund. Impact Capital One Fund was established with Ritsumeikan University, Japan Post Insurance, and the Daiwa Security Group as our LPs at a total size of 7 billion Japanese yen, something around 50 million US dollar. The fund focuses on people's well-being and has extended the investment scope from care economy to include the business related to living, community, and environment, which are all very important to social challenges in Japan. Due to the key macros, we are also continue to operating a Hatarak Fund alongside our new Impact Capital One Fund. By the way, all these 3 funds have same medium risk return profile, targeting ARR of 15 to 25%, which I believe along with the market level return for private equity investment. Furthermore, this is also my personal investment philosophy. Whenever if possible, aim to be both an investor and a user of the service we invest in. And another interesting is that the investment committee members for both Hatarak Fund and Impact Capital One Fund are all women, not by design, but just by nature. Next slide, please. Now I would like to move on to share some case studies of portfolio companies in care economy. Next slide, please. Here are the 11 portfolios of Hatarak Fund. Among them, the 5 highlighted in green are care economy related. For childcare, we have Unifa, which provides IoT solutions to help childcare centers become smart, reducing the burden on caregivers and improve the quality of childcare. And for healthcare, our portfolios including QApp, a digital therapeutics provider, and UB, which offer AI-powered medical services. And for elder care, we have invested in an on-demand staffing working sharing platform. And for household care, Underway is a home-cooked meal delivery service that deliver handmade daily to users' homes at their preferred time for cold shipping, targeting to ease the burden of daily meal preparation. And our family often use this service. And due to time issues, I won't be able to go into the details on each case. Instead, I would like to focus on Kitech as a case study to give you more ideas of investing in Japan's care economy, particularly in the area of the elder care. Next slide, please. Kitech, as a work sharing platform, is addressing several serious social challenges in Japan. First, as shown in this chart, Japan has the highest aging rate in the world. While the total population is shrinking, the number of elder people is increasing very quickly. Next slide. Second, when it comes to the caregiving and nursing workforce, talent challenges are significant. The job openings to applicant ratios is over 3 times for caregiving roles and over 2 times for nursing staff. And by year of 2014, the shortfall in caregivers is expected to reach around 570,000. Next slide, please. This shortage put real pressure on both care facility and the care workers. In Japan, care facility must meet a legally mandated staffing level, but hiring quickly is often difficult. At the same time, labor and operating costs continue to rise. For care workers, they also facing tough conditions. Monthly shift changes make it very difficult for them to make personal plans, and they are even often asked to cover for sick colleagues, making them stressful and the team relationship doesn't work well. Low pay and poor working environment remains as some other serious concerns. Next slide, please. Caregivers turnover rate is constantly very high. Looking at the reasons for leaving, 40% cite workplace relationship, 33 want more flexible schedules, and many also leave due to unsatisfied income levels. Next slide, please. These are exactly the issues Kitech is solving. The company focuses on what it is called unutilized time. The company also calls it hidden treasure within Japan's care and medical workforce. The hours when certified care workers are available but unable to commit to full-time jobs due to personal issues. Kitech's platform uses technology to match this time with facility that need support. Next slide, please. Kitech has introduced an entirely new way of working in this industry, something that didn't exist before. Traditionally, care facility post long-term or full-time positions, while many care workers could only commit to single day or night shift, especially for women. Now with their platform, facility can easily post jobs for just a few hours or a single day. Care workers can finally turn their unutilized time into flexible, meaningful work. Next slide, please. This chart shows how the platform works in practice, and an end-to-end seamless process with all solutions provided online. Next slide, please. It will be the last slide. As a result, now more than 16,000 facilities and 830,000 certified workers are now registered on this platform. By the way, among these registered workers, 50%, 80%, are women. The failure rate last year has exceeded 90%. Since our investment in year 2020, the company's revenue have grown by more than 60 times in just 3 years. That's all from my side. I hope these insights are helpful. Back to you, Agnes.
Thank you so much, Unmei. Listening to you, there is no doubt that there are a lot of diverse smart investments in the care sector. So thank you for sharing that. We have now a few minutes left for additional discussion. I would like to ask a follow-up question to Tamar. Tamar, you shared private-public partnership examples in your presentation. In PPP models, profits often do not materialize immediately, which can discourage private investment. Tatiana already highlighted some key policy tools to support gender-led investing by private entities. But from your perspective and based on your operational experience, what incentives and policy measures can help attract private sector participation while ensuring financial sustainability and accessibility for lower income families?
Thank you very much, Agnes. Indeed, this is a very important question, and you are right. In many public-private partnerships, especially in care sector, profit don't really come immediately, which can be a barrier for private investors. But from our experience in Central and West Asia and in other countries as well, there are some practical ways to make these partnerships both attractive and sustainable, especially for vulnerable families. And as you mentioned, there are some tools that could be applied. In this case, a few I can list now. For instance, blended finance and risk sharing, when the governments or development partners can cover part of the upfront costs, for instance, or provide guarantees to reduce early investment risks in care. Or it could be more policy-based sort of incentives related to tax or regulatory incentives, such as tax breaks or reducing licensing fees that can lower operation costs. There are also that could be applied in this case, some capacity building support that could be provided by the private sector, for instance, training, quality assurance, and management guarantees that strengthens providers' capacity or reduces the risks and improves the service quality, which is also very, very important when we talk about the care. It's not about the accessibility, but it's very much all about the quality of care and inclusion in this case. And finally, long-term contracts, which clearly which can have a clear exit strategies that can give private partners more predictability, and while ensuring standards are also met, the quality is also met. So all these tools are used in our PPP models, actually. When we try invest in different sectors and in care infrastructure. In short, basically a mix of smart investment, risk mitigation, and support can attract private investors in the care sector without really compromising accessibility and sustainability, especially for lower income families. So that's how it works in terms of the public-private partnership. And
Thank
that's
you,
what
Tamar. Thank you very much, Tamar. Very clear. It's good to see that, such a broad list of instruments is actually available. Now turning to Tatiana, the 3Rs framework, recognize, reduce, and redistribute unpaid care work, is often discussed conceptually, but less clear in implementation. What practical steps can policymakers take to embed the 3Rs into national financing strategies from your perspective? And could you share some examples with us?
Thanks a lot, Agnes, for this question. Here you go.
Yes.
Thanks. Thanks for muting your mic. Indeed, the key element always is to understand what is your current situation, depending on the national traditions and the economic situation in the society. Every country is different. There could be some similarities, but ultimately, every country is unique with its composition of gender roles, of the economic situation, of main sectors that are developed in this country, of main working models. They all differ. However, as also Tamar mentioned, certain tool sets which countries can use, policymakers can use, they pretty much universal, but the application to each country will be different. First, the government has to do the research. What is actually a situation? What are the key problems that we are facing right now? Mostly agricultural countries will differ from the mostly urbanized countries. That's the direction we're all moving towards. And then the consideration should start, what is our baseline level? What is the current participation of women in the paid work? That's the first. What is the current pay gap? What are current solutions do we have in the country for care economy, and what are the current challenges? I will give, since we're in Japan right now, and that's the country of my focus for 2X, I would like to give specifically example of Japan, which may give a wonderful introduction, actually, what the situation is. I will give a bit of a more flavor, what is happening right now. The Japanese government realized that they're pretty low, let's say, at the gender equality ranking. This year's ranking by the World Economic Forum showed that Japan takes the place, is ranks 118 out of 148. It means that pretty low start. However, there are a couple of low-hanging fruits, and that should make showed how successful companies like Kaitec are, shows that the market is ripe and there are some benefits to make in that market, given the demand is higher than the supply. The way the Japanese government is doing it, I find quite also wise. For example, the Financial Services Agency recognized that we're speaking about, from the gender perspective, including, we're speaking about transforming the economy, introducing social environmental impact indicators into our financial decisions. However, Japan should be aware what are key indicators in addition to financials that we should use. And that's how the Financial Services Agency that regulates all banks, all investors in the country, established so-called impact consortium that were tasked to look at all available environmental and social impact metrics and select only the ones that are relevant to the Japanese economy. And that's how this year in July, the Impact Consortium issued its first report, where it listed several groups of indicators: environmental, including climate, blue economy, because Japan is a coastal country. The ocean is extremely important. Ever since it relates to sustainable use of the ocean is important, and the set of social indicators, where it listed indicators that are relevant to ensuring gender equal society in Japan. And one of those indicators was also included as 2X Global, where they realized that gender equality is an issue, but it's also ensuring gender equality in the workplace is an important resource to boost Japan's economy. And the next step is socializing the standard with financial institutions to connect financial risks and benefits to diversifying Japan's workforce to make companies and economy more successful. That's the example what I would like to give, and I think that could be replicable in other countries.
Thank you very much for this comprehensive response and such an interesting example. So now turning to Shunmei, I have two questions for you, Shunmei. So you are managing venture capital and you have supported several startups. What do you see as the main policy or tools that enable venture capital investment in the care economy, or what's really critical from your perspective to bring in this capital into the care economy? And the second question is about scaling up. From your experience in Japan with startups, what are the critical factors that determine whether an innovation in the care economy can successfully be scaled up from pilot stage to nationwide adoption? So we will welcome your response.
Yes, thank you so much. I was always impressed by Tatiana. She always mentioned the really update on what happened in Japan. And she also mentioned the impact consortium. Yes, I think as a tool, maybe IB impact investment can be a powerful framework to support VC investment, the investment in care economy. The impact measure and the management process and tools can help the companies to pursue both business growth and also social impact while avoiding missing mission drift. One key tool is the impact logic model, which is something map the pathway from the company's product or service to short-term outcome or output, medium-term outcome, and a long-term impact. This model also includes stakeholders' perspectives, not just business partner, but also end users, helping the company improve their service. Impact investors also support the companies in setting impact metrics and KPIs, which providing evidence-based insights from both continuous the business improvement. And another interesting is Japan also has made progress in linking impact investing with capital market. It's quite unique. 70% of the Japan startups exit strategy is based on IPO. So a successful IPO really close linked to future sustainable growth. And in year 2023, GSG Impact Japan launched an Impact IPO working group, and in last May published guidance for impact companies on disclosure and dialogue in capital market. I think it is not the new one for Japan. Maybe it's the first one globally. And last winter, a healthcare startup called Eugalia, they have successful went a public offering, and they referring to this impact IPO guidance and achieved a very successful impact focused investors cornerstone during the IPO process. And the current market cap is already over $200 million. Furthermore, we also see, as Tatiana mentioned, that the government-driven initiatives for impact investing are growing very quickly. The government launched the Impact Consortium, and already more than 400 companies and individuals participate, promoting the peer learning and the framework development. And when I started impact investment in Shinsei in year 2017, the Japanese impact market was just 70 billion Japanese yen. But last year, the market size has reached 17 trillion, which is something 120 billion US dollar. So 214 times in just 7 years. And the care economy has already become one of the key sectors for investment, impact investment. So I think with the huge market potential, also the impact investment to development and progress and government support, the care economy related startup has strong potential to grow their business to solve social challenges and also attractive, be a very attractive investment opportunity. But as mentioned, it is always very difficult for some startup because of stable issues, and sometimes because of it's difficult to find a payer. So the monetize always take time. But as I mentioned, with the impact investment program, like a logical model, which will show the business in a more long way, so it will make them more ready to design the business in a long vision without a mission drift. So it will be make this investment and the impact the investors' contribution can also help the company to grow the business in a more sustainable way.
Thank you, Shunmei. Yeah, it looks like there is a whole ecosystem supporting this scaling up, which is happening in Japan. So thank you for sharing that. It is now time to close this episode. So I want to sincerely thank our panelists for sharing knowledge as well as experiences so that all stakeholders, policymakers, investors, care facilities can seize the full potential of investing in the care economy for the benefits of women, for the benefits of people in need of care, for the benefits of families, and for the benefit of the whole society and economy, as such investments are producing long-term economic and social impact. What is important is to recognize that the public-private collaboration is key to achieve these results. While private entities provide funds and technologies, public actors and policymakers are critical to ensure accessibility, affordability, and quality of care through the creation of financial incentives or the promotion of standards like 2X, for example. Thank you for joining this webinar. The recording will be uploaded to the event webpage shortly. Please also take a few moments to complete our post-event survey. We want to get your feedback on the quality of this webinar so that we can improve our future webinars. Have a wonderful day, and we look forward to welcoming you to our future events. See you soon.
Thank you.
Thank you very
so
much.
much. Thank you very much.